I'm Dr. Amiya Prasad. I'm a cosmetic, oculofacial, plastic and reconstructive surgeon practicing in Manhattan's Upper East Side and Garden City, Long Island. I specialize in eyelid and facelift surgery, and I'm answering an interesting question today. And the question is on realself.com. The question reads, is it advisable to consider a facelift with an oculoplastic surgeon? Before answering that specifically, I want to address some of the responses that were posted by my colleagues. Several of my colleagues wrote answers such as addressing things such as board certification, stating that oculoplastic surgeons were not qualified to do these procedures. But when it come down to it, not a single one of those doctors who answered this question have any idea on what that particular oculoplastic surgeon's background is, nor their level of training, their experience, their expertise. I have to say that I'm very taken aback by those responses. Since I specialize in cosmetic, eyelid, and facelifting surgery, I thought the question itself was a little bit generic. And so this leads me to just help our viewers understand a problem in our field of cosmetic surgery. When you ask a broad question like this, you're going to get a lot of answers where people are only interested in promoting themselves. When these colleagues wrote their answers, there was one basic reality, unfortunately, with most of the answers. And that was there was a conflict of interest. When it comes down to it, the financial issues of competition in medicine have changed the way physicians behave. And physicians who were formerly collegial have become adversarial, and in the end they've started to act more like politicians by slinging mud rather than professionals whose primary goal is to advocate for you, the patient. So I'm going to speak to one core basic principle, which is to advocate for patients. When you're doing research about cosmetic surgery, you have some basic tools that you need to understand. First of all, cosmetic surgery is its own specialty, covering all matters aesthetic. And it covers everything from head to toe. Everything from eyelid surgery, facelift surgery, Botox injections to liposuction, hair transplants, breast augmentation. And plastic surgery is a field which is broadly covered by several specialties. So when you think of plastic surgeons, you think of general plastic surgeons, but when you think of what the word plastic means, it means plastic is from plastikos, from Greek, which means to change. So the surgery is to change. The field of plastic surgery has gone through a lot of advancement, particularly over the past 20 to 30 years. And several specialties have actually added a lot of advanced, not only training, but techniques, and has made ultimately a better field for the public to enjoy. I use examples when I have my conversations with many of my patients that the single greatest advancement in liposuction surgery was created by Jeffrey Klein, who was a dermatologist. I have seen incredible liposuction performed by OBGYN doctors. And frankly, as far as facelifting is concerned, two of the best facelift surgeons I've ever seen personally work are both oral maxillofacial surgeons, and original training was dentistry. When it comes to this particular area of facelifting surgery, any surgical specialty which has exposure in their basic training to facelifting surgery or working in the area of the face where facelifting is done is qualified to at least begin the process of becoming masters at facelifting surgery. So what does it take to become an expert? I think that no patient wants to go to a novice, or no one wants to go to somebody who has only done a few. So this is a time where being a specialist, I think, has added tremendous value for the patient who's interested in getting the best work possible for their face. Then they have a lot more choices than they used to, and it is important to use other guidelines than just using a broad umbrella like one specialty versus another specialty. So the question again is it advisable to consider a facelift with an oculoplastic surgeon? And my answer is, it depends. That same answer, it depends, also can be used for any surgeon of any specialty where facelifting is performed. This includes plastic surgeons, ear, nose, and throat surgeons, oral maxillofacial surgeons, dermatologists. So what we have to ask ourselves is, what qualifies a doctor to do surgery of the type that you're asking? To give some contrast here, one of our colleagues actually wrote that the board certification in one specialty was superior to every other specialty. When you look at board certification, just going back to that, or the determining of who is qualified based on their background, board certification in any specialty does not ever really test artistry, ethics, artistic vision, technical skills. We can go to people, as someone who's a teacher, as I have been for 20 years, someone who's taught doctors in every specialty, from dermatology, plastic surgery, otolaryngology, in every field, I can tell you that they may be, a particular doctor may be very good on paper and taking exams, but when you hand them the scalpel, they may not have the soft touch and the artistry necessary to do the work that everybody would want. So we have to really start to filter what kind of advice you need so that you can make a good decision. Ultimately, that's what it's all about. That when you're evaluating who is qualified to do your facelifting procedure, it's important, yes, to know that the doctor has a foundation and background. But then the next thing is to understand is, what is their level of experience? What you trained in many years ago and what you do day to day can be very, very different. And it is important to ask the question, how many facelifts do you do? How many do you do a week? How often do you do them? When you ask about how many do you do in a week, look at the reaction. Look at the doctor's reaction to this. Look at the staff. Meet the staff and get to know the vibe from the staff, whether or not this doctor is really good at that surgery. Every doctor is an individual and should be judged on their own merit, and not as a member of one group versus another. So I hope this answer was helpful for you. If you have certainly more questions, you can ask more on realself.com, and hope that you're able to find the right doctor for you. Thank you.